For more analysis on this, Abu Eqtaish joins me from Ramallah in the occupied West Bank. He's the Accountability Programme Director at Defence for Children International Palestine. Welcome, Ayed. So tell me first, what kind of state are these children in who need urgent medical evacuation? Roughly 4,000 of them.
We at DCI Palestine believe that it's an old problem. It was before the start of the war against Gaza Strip, because the health system in Gaza is not developed to deal with all illnesses of children in Gaza. So during the past period, children who are in need for more developed medical care used to suffer before being able to receive the needed care that they are in need for, because they have to apply to travel to hospitals in the West Bank or to hospitals in Israel, especially children who are suffering from cancer or other severe illnesses. So the rate of permits that have been denied by the Israelis was very high, and many children died before even being able to travel to receive health care outside. Now the situation is more severe and more complicated, because almost there is no health sector in Gaza Strip. It's totally destroyed. So and there is no medical equipment or medicine in Gaza. So almost all Palestinian injured children and sick children are in need for medication outside of Gaza Strip, because the Israeli authorities during the 2 years of its genocide destroyed the health system in Gaza Strip. So, and the whole environment prevailed in Gaza, the sanitation situation, the lack of water, children are drinking dirty water. So all of this situation, it's fertile for the spread of diseases among children.
Certainly.
We come across many children who suffer from skin diseases that need to be evacuated outside.
Sorry to interrupt you there, Ayed, but I wanted to ask you about the issue of the Rafah crossing. Of course, that is still blocked, not yet reopened by Israel. If Israel were to simply reopen that crossing, how far would that go in order to in getting some of these sick children outside of Gaza to the healthcare that they need?
I think that Israel is using Rafah crossing as a chip in order to put pressure on Palestinians. We believe that all crossings to Gaza should be open in order to enable the influx of humanitarian necessities to reach Gaza, and for people to travel outside to receive medication outside of Gaza. But Israel is using the crossing and its control and grip control on these crossings in order to put pressure on Palestinians, in order to implement what Israel wants the Palestinians in Gaza to do. And we believe that the lives of many children in Gaza are at the stake because of the continuation of closing the crossings, especially for children to receive medical assistance outside of Gaza, because the time is very important for them. And many children, their situation do not bear any postponing, because they are in urgent need to receive medication.
As you say, some of those kids are really sick, and of the 15,000 that the WHO, 15,000 people that the WHO say needs urgent evacuation, about a third, almost a third of those are children. How much longer will some of those children be able to survive, given the state that we know Gaza's hospitals are in and the depleted nature of medical resources there?
All indication indicate that the time is against sick children who are living in Gaza Strip, because now they can't receive treatment in Gaza. And also there is no medicine, there is no medical equipment. So almost the majority of children who were suffering from kidney failure already, they died. Many children who suffer from cancer also, they died because they were in need for medical care outside of Gaza Strip. And now even children who are suffering from less severe illnesses may die as a result of the lack of medication inside Gaza Strip. So they are in immense need to be evacuated to receive healthcare outside of Gaza. And it's the responsibility of the international community to put pressure on Israel to open the crossings for Palestinian children to receive medication outside, because it's death penalty against them, because there is no medical care or medicine inside Gaza Strip, and they are prevented from traveling outside to receive the medication that they are in need for.
Abu Eqtaish, the Accountability Programme Director at Defence for Children International Palestine, thanks so much for your time with us today.